As many of you know, we put a strong emphasis on resident care and satisfaction. We measure that in a lot of different ways. First, our resident satisfaction survey. Second, our occupancy. When those numbers are high, we know people want to come here, and word of mouth makes that easy. Third, our health systems that we work with make referrals, like Lancaster General or Hershey Med. That's a good sign. And lastly, what I want to talk to you about today is our Department of Health survey. It's how the government measures our satisfaction. You may have heard of the 5-star survey system. This summer and every summer, we get visited by the Department of Health and they assess our skilled nursing care center. They do that in a lot of different ways and they measure us in a couple different components. There's primarily 4. The first 2 are staffing related. RN staffing and overall staffing are critical to our success here and the care that we provide. We typically get a 4 or 5-star in that area. The third component is quality measure. Quality measures are things like weight loss or falls. There's over a dozen of those that we get assessed monthly on and actually get awarded an overall star for those. We typically are 4 and have been working hard to get a 5-star in that area as well. As you can tell, we're pretty proud of those numbers. The one area that we seem to struggle with is the actual inspection, where they come out for a few days and look at records, visit with residents, talk to staff, and just walk through our community, our facility, to notice things like cleanliness, smells and odors, or lack thereof in our case, and at the end of the day, assess us on their findings. They call those findings deficiencies. In our case, we had a difficult summer. We ended up with deficiencies that resulted in a 1-star visit for that survey group. When you combine that with our overall 4 and 5 stars in the other areas, it ends up with an overall 2-star rating from Masonic Village. To explain the recent findings, I'd like to introduce you to our administrator of the healthcare center, Bob Druckenmiller.
In July, we had our annual Department of Health survey, and we received a total of 9 deficiencies from the Department of Health. 4 of those were related to documentation, either it was inaccurate or incomplete. We had 1 for a family member who was not notified of a changing condition of the resident. We had another tag for the storage of medications within our carts. They were not stored properly. 1 resident went to see the psychologist and should have seen the psychiatrist, so that ended up in a deficiency. We received another deficiency for our food storage, that items were opened were not labeled properly, and we received 1 deficiency for 2 residents who had weight loss, and we fought that deficiency feeling that the weight loss was acceptable, and unfortunately that appeal had been turned down.
The reason we came to the village from Lower Bucks was because we'd had a very good friend who lived here. He was older than us. And watching him go through the healthcare center and through the hospice program, being a social worker myself, I knew that this was the place that we wanted to be. Because of the quality of care, you know, being a social worker and working in hospitals and working with facilities, geriatric types of facilities in the past, I saw that they're only as good as the people working at them. And one of the problems with, you know, these ratings and things is they're bean counters. And there's a rule that I was taught in social worker: if you don't document it, it didn't happen. Well, sometimes when you're in the midst of a crisis, your attention should be on the person who's in crisis, not on your pen. So occasionally, you know, paperwork that will get missed. Not on a regular basis, just occasionally. But that's what shows up in these kinds of ratings. And I find that very frustrating, both as a professional and as a resident.
So what you might ask yourself is, why do we struggle with this one component of the overall 5-star rating, this health inspection? Well, there's a couple things working against us. Just in the last 3 or 4 years, we have gone through extensive renovation in our healthcare center. Every floor, every room, every piece of that facility has been turned upside down really and renovated. Our staff has continued to work under those conditions, at the same time providing the level of care that we are committed to in this organization. Another key area is that we just this summer specifically rolled out our new electronic health record system, which is exactly the system where documentation and all the patient records and information that the state looks at is stored. We're in a huge learning curve, both the preparation and post go live. We're busy times for the staff here. And lastly, just our size. There's very few places around Pennsylvania that have a nursing center the size of ours. At 453 beds, we're actually like 3 nursing centers in one.
The Department of Health came back in last month for 3 days, reviewed our plan of correction, and cleared us that all those deficiencies were corrected. So we made those corrections and adjustments timely. The next step is that we are created a new position called the Director of Quality. This is going to be an experienced RN who's going to focus on those areas of concern. Detail looks at quality issues or concerns, not only the ones we were cited for, but additional items that the Department of Health showed us may be an area of concern in the future. And then our final step to that is we have a team in-house called the mock survey team who tries to audit just like the state would.
We are as disappointed as you might be in our overall results from this summer's survey, but I just want to assure you that my staff, who have a lot of pride in the level of service and quality they deliver each day, are equally disappointed. But we're also equally committed to, as Bob said, make change in this organization that makes our overall rating reflect what we know to be the quality we deliver each and every day at the Village.
I was hauled away from here in late June, the 29th of June, with a very severe abdominal pain. The nurse here detected that pain, or detected my severity, called an ambulance, and I went to the Milton Hershey Medical Center. And then I came back after the discharge from the medical center to the Elizabethtown Masonic Village Healthcare Center Transitional Care, where they transitioned me from my operation back into normal life. The doctors were great, the nurses were great. It was I had a private room, and I could get up and walk around and watch television, and it was quite nice. A good and I got independent. What was most fitting was my independence came back. I wasn't cared for a lot. The nurses could see that I could take care of my personal needs, and they would let me shave and shower and do things on my own, which I did. And it was very good care.
I do most of the tours of the healthcare center and personal care center for admissions. I couldn't sell a candy bar, and I love candy, but I have no problem taking people through the healthcare center because I know it's really good. I don't feel like, oh, don't go down this hall, or be careful of that, because I know how good it is.
And I've been doing this for over 20 years, and I'm very proud of the care that we give to our residents. We are very resident-centered in our care. Anything that a resident needs or wants, we make it our mission to accomplish that. It's something that we're very proud of, and it's not just the nurse managers, it's everyone. It's from nursing, housekeepers, everybody tries to meet the needs of residents. There's some examples that I can think of that have gone on over the last years that have kind of show you what kind of things we do. One of the things we did for one of our residents who turned 100, we found out something that she especially wanted to do, to happen in her life before she died. She wanted to be in the presence of a horse. She wasn't able to go outside, so we contacted Gettysburg Miniature Horse Farm, and we brought a horse to see her. It was an amazing event, and it really brightened her life on her 100th birthday. I will say that through the years, we have never sat still on anything that we've accomplished. We strive to do more and more to make sure that our residents are well cared for, that they get the treatments that they need, the equipment that they need. There's nothing that we don't provide for our residents. Just recently, another one of our residents died, and all the staff on the neighborhood gathered. It was unexpected, but it was a very peaceful experience in spite of the fact that it was unexpected. Everyone gathered together. There were tears, but they were supportive of each other and of the resident's daughter and his wife. It was amazing. But that's something we do every day. Supporting families, being there for their loved ones. And I'm proud of that.